Dear listener, after almost 6 years as a chair of the Department of Family Medicine, I've decided to step down and focus on other things to transform the healthcare system. However, I would like to take this opportunity to discuss some of the challenges and also opportunities that we have faced and that public health and family medicine are facing. First of all, it has been a wonderful experience. I had enjoyed so much working with faculty and staff in the department, meeting so many students that is going to provide excellent care in the future, as well as interacting with college around the campus, the university, and the many community partners and healthcare systems partners across the state. All that had given me tremendous opportunity to learn and also consolidate, and as a department coming up with new ideas when it comes to research, education, also delivery of care. My reflections are, I would like to focus on the three major areas and the three missions we have as a department. The first and most important, of course, is to educate the future physician workforce. It's a great privilege and opportunity to work with our medical students. They are truly focused on becoming doctors who provide the necessary high quality care of the future. And to see them go through the learning process, how they develop in the new shared discovery curriculum, and also how they further develop an understanding of public health and primary care as they are working in the community is just a wonderful experience. I think the students I meet today are socially very engaged. They are concerned about the health inequity. They want to engage and they want to learn more about how they can contribute to creating a healthier community. Not just creating a healthier patient, but how do you work with the community to make sure you achieve health equity? And this is extremely important if we are going to be able to create a healthcare system and also society that makes sure that everybody can live up to their potential. And health is such a critical aspect of living up to our full potential as individuals, but also as a society. And when you see discrepancy in chronic disease, diabetes, hypertension, obesity, even depression, as large as we have in the United States, you understand the healthcare system needs reform, and we need to look at much more at outcome, value-based healthcare, and also address the social determinants of health. It's not enough if I'm a good doctor in the office. When 80% of a patient's health is influenced by other factors, what we call social determinants of health, we understand that we must go out there and work with the community. We must be proactive. We must introduce better programs that promotes well-being. And a lot of that is now coming up on the agenda, and it's going to be a very exciting phase, and where I think primary care can play an enormously important role. And primary care is now rolling up primary care first, where value-based healthcare, we're focusing on social determinants, or what we call upstream factors that are influencing your health before health actually changes, are becoming much more important. So together, all those aspects is really putting a big onus on our education system to make sure that physicians of the future actually has a whole new skill set to work with these aspects, work with social determinants together with the community to really influence health and well-being and longevity. Another thing that was something that transformed the whole educational system was COVID-19. There was hardly any focus on virtual education or virtual care until COVID-19. We had started a transformation in our department where we started thinking, okay, what way can you provide treatment, but also education through telemedicine and other technology-based technologies. That whole area has exploded now, and there's a lot of new startups, but there's also new tools where virtual care informed by increasing self-efficacy among patients is opening up whole new opportunity for providing remote care, where patients and the family and the community becomes much more engaged, and you build empowerment to drive your own health in a whole different way. And also there, it's extremely important that this access to new technology, being empowered, being engaged in your own care, is distributed across all aspects of society, so we don't get another digital divide. But I think that employing wearable, remote sensing, increasing motivation to change behavior, and we know behavior drives maybe 60-70% of the healthcare cost and contributes to 2/3 of the chronic diseases we are suffering with. That is so important, and we're going to see increasing innovation in that whole area where technological-based, cloud-based services provides a whole new way of patient to be empowered in their own care. And physician and healthcare system is going to play an enormous role, of course, to be part of this ecology to make sure health outcome improves and you reach the level that we should be able to reach. Another aspect of the healthcare system we're going to have to battle with is the healthcare cost. We basically spend 18% of our gross national product on healthcare, and the outcome is dismal. We deliver healthcare outcomes that are worse than the average for other rich countries, even though we spend so much more. And basically it's because of we are very poor in preventing and managing chronic diseases. And we know these chronic diseases are associated with tremendous increase in cost. And number one there as a cost driver is actually mental health and depression. If a person is depressed in the workplace, for example, that person costs just for healthcare 40% more than a person who is not depressed but otherwise have the same health, age, gender, etc. So we need to put a much bigger focus on addressing chronic diseases. And I think moving now from the traditional chronic disease model, patient-centered medical homes, we now see a focus towards the communities. So you can call it patient-centered wellness homes, where the patient, the person, is integrated in the community, and it's the wellness of the community, the way the community can support health-oriented behavior becomes very, very important. And you could argue that the community should be measured. And we have a great basis here when you look at community health assessment that is done all over the states. Community health assessment offers a very, very rich opportunity to identify what else can we do as a community to build wellness, to build health equity. And that platform, the community-based platform, is an extreme under-tapped resource to build health equity. And I think we're going to see a lot of exciting initiatives in that sphere. When it comes to working with healthcare partners, this has been very, very exciting. To work with Sparrow, Spectrum Health, McLaren, and also Mercy Health has been important for the department because we have been enriched by a lot of experience how these different kind of healthcare systems have looked at the future. How are they addressing challenges? We have, for example, worked with innovative primary care, Dr. Ryle's primary care center in Grand Rapids. That is basically experimental home for Trinity when it comes to developing primary care of the future. And we have worked together with them to show how you can address stress, bottom line, patient experience, and also quality issues by radically reforming the way patients interact with healthcare system, that everybody is working at top of their license. That means that you get to use more of your skills as a staff and a doctor, and it's a win-win. And in that you can include new technology that basically decreases the exposure to provider and staff to tasks that is tedious and increase burnout. And a lot of that task can today be done by new technology. So working with resources like that in our healthcare community offers great opportunity also for us to bring back to our own clinic to see how we can improve care and how we can improve processes with a focus on team-based care and patient-centeredness. So altogether, we can see that it has a lot of opportunities, a lot of improvement in education of medical students, a lot of exciting things going on in the healthcare community and community-centered care. And we also have had a fascinating and I think impressive growth in research, where we've gone from being non-ranked by NIH in the Blue Ridge report to today being number 20 in the country. And that could not happen without the successful and impressive research we have in the department. A tenure track researcher, we have world-class researchers in areas like marijuana, cannabis, when it comes to engaging behavior aspect in the care process, especially targeting young people, but also when it comes to the impact of environmental factor on health, for example, air pollution. And I'm really pleased to see how our basic sciences researcher collaborate with our clinicians and even engaging med students in addressing seriously and very challenging public health problems, that we realize that we need more basic science, we need more translational science, and we also need working together with clinician and community and the patient in order to address these challenges. So in rounding off, I would say that I am very, very pleased. I'm very happy to have had this opportunity, and I'm looking forward to my next phase, but I'm also looking forward to seeing how primary care is going to develop and actually be the platform to provide the healthcare of the future, where I think we're going to see an increasing focus on the value-based healthcare and what are we actually achieving as a healthcare system. And to achieve optimal results, we need community engagement, we need patient engagement, empowerment together with the healthcare system. So thank you very much, and stay well.